Hi everyone, Dr. Bruce here. In this video, I'm going to go over some of the skull anatomy. So I'm in my 3D model page on my website, and feel free to use these models to help you learn about the anatomical structures for many of the body systems. So let's take a look at the skull. We're going to look at this first 3D model here. Let's go ahead and open it up. Let it res in. Let's get it sized right. So here's the skull, the bones of the skull. Let's start with some of the easier bones. I'm not going to have to go through every single bone, but just the more important ones. So in the front, we have the frontal bone. If you look to the side, we have the parietal bone. And in the back, we have the occipital bone. So frontal, parietal, occipital. Below the parietal bone, we have the temporal bone. Now in the front, we have the frontal bone again. We have the nasal bones here. We also have the maxilla, and then this is the zygomatic bone, which forms the zygomatic arch, or part of it, and then the mandible. So it's frontal, nasal, maxilla, and mandible. Some of the other landmarks that are also important would be, underneath here, we have the palatine bone, which helps form part of the hard palate. So you want to start by learning the major bones first, and then look at the bony landmarks. The annotations are nice because you can try to name the bone and then click on the annotation, and it'll tell you the answer. Okay, so let's use a different one. Let's go to the second skull one, skull 2. Let's let that load. Come on in. Okay, there are some different landmarks here. There are some of the sutures that are labeled. So we have the sagittal suture goes down, the middle of the skull and separates the two parietal bones. We also have the coronal suture, that's this one right here. And then we have the squamosal suture that separates the parietal and temporal bones. And in the back, we have the lambdoidal suture that separates the parietal bones from the occipital bone. Some other important landmarks here are, of course, the zygomatic arch, which consists of the temporal process of the zygomatic bone here and the zygomatic process of the temporal bone here, but the zygomatic arch. And if you tip the skull over, you can see a nice view of the zygomatic arch right here. There are also some landmarks on the temporal bone. There's the mastoid process right here. There's the external auditory meatus, sometimes called the external auditory canal. It's the ear canal, and the styloid process over here. There are also some foramen. There's the mental foramen here. Oh, and this is the temporomandibular joint, another important landmark. Okay, let's look at a different model. This is one of the newer models down at the bottom here. Let's look at the cranium. So in this particular model, I removed the parietal bones to allow you to look inside of the cranium. They call it the cranial vault, and this is the floor of the cranial vault. So we have some important bones here. This, of course, is the frontal bone again, and then we have the ethmoid bone. That's this bone right in here. It's kind of, inside of the frontal bone. And the ethmoid bone has two important structures. There's what's called the cribriform plate and the crista galli. If you click on the annotation, it'll tell you about that. So basically, the cribriform plate is the flat area that has holes. So actually, nerve fibers from the olfactory nerve flow through these holes, go through these holes in the cribriform plate. The crista galli is a ridge that connects part of the dura, of the covering of the brain. Then we have this large bone here called the sphenoid bone. The sphenoid bone consists of two wings, the greater and lesser wings. This is the lesser wing up at the top here, and this is the greater wing. Kind of looks like a bat. Another important landmark is the sella turcica right here, or Turkish saddle. This groove right here, this is where the pituitary gland resides. And then, of course, we have the temporal bone here. We have the foramen ovale and foramen rotunda. And then we have the foramen magnum. And foramen means whole, magnum means large, so it's the large hole. So you want to rotate this around and kind of look at it from different angles. It really helps you get an idea of the perspective, how the bones go together. Okay, I think that'll do it for this video. Hopefully this helps you learn about the bones of the skull. Feel free to look at this as many times as you want. Use the models, use the annotations, try to name the bones, and then you can click on the annotation. It'll tell you what the bone is. And again, hopefully this helps, and we'll see you in cyberspace.